Hi, today we have Dr. Teresa Sievers with us, our medical expert, and we're going to be talking about arthritis. And we're going to be talking about septic arthritis.
Okay.
And what is septic arthritis?
Septic arthritis is an acute infectious arthritis, and it is localized to one joint. It is caused by bacteria typically, although it can be other. Typical bacteria might include Neisseria, Streptococcus, Staphylococcus, might be types of organisms that would cause it. And the way people get the arthritis varies. It can be from a joint aspiration in the office for an osteoarthritis or a rheumatoid arthritis. Maybe proper technique wasn't used. It could be from having a joint replacement in the hospital. It can be from being acutely systemically ill, such as an older person who might get a urinary tract infection. It gets into their blood, and then it goes to a joint. Typically, the body goes to its weakest link. And so if the joint's already damaged from arthritis, that's where that infection might settle in. And it's a serious situation. That joint needs to be drained. We need to send it for culture to find out what it is. They need antibiotics, and it can usually be treated very well. The problem is that infection has done a lot of damage to the joint, and after that acute phase, people often come in thinking that they still have the infection in the joint because they still have the pain. And I explain to them, no, actually, you don't have a fever, your white blood cell count is normal, there's really not fluid in there, you're just having pain because the joint's been destroyed or partially destroyed, and that's where the pain's coming from, and there's still inflammation in the joint.
Sure. And Dr. Sievers, I noticed that you have a lot of supplements on here, so you're a big advocate of nutritional supplements and supplementation. What would you recommend for someone with septic arthritis? What road should they go on to avoid that in the future?
Right. So they should always work on diet first, and we don't need to get into that. But the basic premise, low sugar diets, lots of plant-based foods, getting good exercise, avoiding excessive alcohol and caffeine, those are pretty basic. But then we get to the supplement aspect, and there are a lot of things you can use. I mean, the market's flooded with them. Fish oil's a gold standard, MSM, glucosamine, those are all common agents that people use. But when I start handing people 2, 3, 4 bottles that they need to take, they get overwhelmed. Oh my God, I gotta take all these pills. And that's where I found a big benefit with Flexcin because it carries several ingredients in there.
Right.
And then I'll have patients say, well, I have already taken glucosamine, I have already taken MSM, it doesn't work, it's not working enough. And what's unique about their product and why I'm so happy to be using it is that it has cetyl myristoyl in it, which is an essential fatty acid. It's not in other joint arthritic treatments, and that is the benefit because it actually can calm down the immune system. And when we're talking about a septic arthritis, their immune system's been turned on. We need to calm it down. Right. And when you use that, it calms down, and then the other agents, such as the MSM, can get in there to help with inflammation, and also has sulfur in it, which helps repair the joint. We can get the glucosamine in there, and it works great. The other key ingredient is, as I was saying with the nutrition, you have to be able to digest and absorb what you're taking.
Sure.
And there are already digestive enzymes in there to help the product be absorbed. Yeah,
yes.
And they really get they get relief within a week, 2 weeks. They can start noticing improvement. By a month, 4 to 6 weeks, they're in a good spot. I do put them on a higher dose in the beginning. I like to use the joint loading formula, at least 2 pills twice a day, which is this one right here.
Okay.
And if it's really bad, I say, you can do 2 tablets 3 times a day.
Can't overdose on it.
You can't really overdose. Right. There's people worry about drug interactions. There's really no drug interactions to be concerned with, and it's a great product, so I get good relief with it.
Great, great.
Yeah.
Okay, well, here you have it. You heard it from the expert.